Let's chat.
January is Cervical Cancer Awareness Month, and here to give us all the information that we need to know to take care of ourselves and those around us is Miss Jenny Lawson. Thanks for joining us, Jenny.
Thank you for having me.
Great to see you again.
Nice to see you too.
All right, so tell us, what do we need to know about this month, about cervical cancer? And really, what do we need to know about lowering our risks for cervical cancer as well?
Right, so January is Cervical Cancer Awareness Month. And there are different ways that we can lower our risk. The first and most important is the HPV vaccine. And that actually starts earlier than you may think.
Right.
The boys and girls can get the vaccine starting at age 9. It's recommended at an age around 11. And then they've just expanded the age to age 45. So we want to make sure that we get the HPV vaccines. There are over 200 strands of HPV, and the vaccine protects against 2 different strands that cause cervical cancer. Okay. And the other way that we can lower our risk is by screenings, and so that's your pap smear, and then they also can test for HPV.
So how often do we need to be, having these screenings and seeing our doctor and this being a conversation?
So every woman should have a yearly women's health exam. And then at that exam, the doctor will discuss what screenings that you need to have. And that really depends on when the last time you were screened and what those results were. So go into your yearly exam, and speaking with your provider is the best way to find out what screenings are due and when.
And a lot of people may be wondering, well, especially if they possibly have a family history, but maybe they don't have health insurance. Is it still possible for them to have those screenings and be proactive?
Yes, that is not a problem. At the health department, we have a place for every woman, no matter what your financial needs are, whether you have insurance or not. Tennessee Breast and Cervical Program covers well woman exams. It covers pap tests. It also covers mammograms, which is part of your women's health.
Right.
And if you don't qualify for Tennessee Breast and Cervical, we have other programs where we can get those services covered for you.
You find a way to take care of everyone.
Yes, exactly.
You always do. That's one thing I love about everything that you offer, especially when it comes to women's health, because so many people go without these necessary screenings, these necessary conversations, because they don't have the insurance.
Yes.
But there's a way to still take care of ourselves.
Absolutely, absolutely.
So tell me about these services, and how do we take advantage of those? Is it a walk-in basis? Do we need an appointment? What's all this information?
Sure. We have nurse practitioners that do these services, and it is by appointment. But we also have community partners that do Tennessee Breast and Cervical that can take advantage of these services. So patients can just give me a call, which is 209-8009, and I can help navigate them to where they need to go. Perfect.
So the best way to get started is just to give you a call and talk through our situation.
Yes.
Everyone's different. Yes. All right, give us that phone number one more time, please, Jenny.
Okay, it's 209-8009.
Okay, and of course you can always visit them 24/7 online for more information as well. Jenny, thanks so much for joining us, and thank you for reminding us to take care of ourselves and those around us.
Thank you for having me.